here. She's pointing at the door. You ready? We're gonna bring her into mama. You ready to see mama? You ready to see mama? You ready? Sometimes she's a little crazy when she starts to. Oh.
Hi.
Hey, Desma.
What happened, Cheeky? It's a rat. What happened, Mishies? Excuse me. Where's my hug? Are you yelling at me? Oh yeah, she was just. That was not a laugh. That was a cry. And leave me alone. Oh.
Oh.
You okay? Because you just woke up, huh, silly goose?
Every time she just wakes up, she tries to walk, and she's just walking real drunk.
Guys, she loves her. Where's Saya? Where's Saya? There she is. There's my baby. Where's Saya? Have you seen Saya, babe? Huh?
Saya, where are you?
Really? Did you sleep okay, Mama? Yeah? You did or no?
She loves to hide. I'm gonna get you. I'm gonna get you. Where are you? Hey! I'm gonna get you. I'm gonna get you. I'm gonna get you. I'm gonna get you. Oh.
Where's Saya? Oh!
There she is.
Hi, big lady. Oh. Oh.
Uh-oh.
Who's this girl? Who's this girl? Oh. It's just a lot of movement. You just got up. Sweet cheeks, why don't you chill a little bit? No, she's got to get straight to it, this one. Hi, guys. So. First of all, let me give you a little update on my teeth situation. They're very jagged at the end, okay? I'm actually getting my teeth put in 2 days, my permanent teeth, which I'm so fucking excited about. And these Tems, honestly, have been doing what they need to do, though. Like, besides this part looking crazy, the sensitivity I got used to within the first couple days. Even one broke back here. I'm not going to show you because it looks crazy. But this temporary tooth that broke, it was like sensitive for 1 day, and now it actually feels okay. So they've actually been serving me well. And honestly, like I said, if you're far away from me, you're not really noticing much. If I'm up close and talking, you're like, girl, like you need to shave those teeth down and make them even. But if you're far away, nothing. Up close, looks so... honestly, though, it's just these front two and this. Because even the way that they look, it does not look bad. So this experience, the temporaries, have been honestly a 10/10 experience. So anyways, I'm just coming on here to explain to you guys what I'm going to be doing today. So as you know, I would say like 2 months in that. It was about like 3-4 months ago. I found these lumps in my boobs when I had lost more weight, and I was obviously concerned about them. And so I ended up going to get imaging of my breast done. I got a mammogram ultrasound. They were going to potentially have to biopsy it, but then he was able to identify that it's actually fat necrosis, which is like fat that has died within my breasts. So they're like balls, and within these balls there's like dead fat, right? That's hard. And there's also oil and liquid. So he basically was like, we're going to make an incision, and not an incision, we're going to take this needle, put it into your breast, and pull out the liquid from those lumps, and it'll bring you a lot more comfort. Because obviously the point is I wanted to make sure that nothing was serious, and thank you God it wasn't. But when I do sleep, I sleep on my stomach, and it like is very uncomfortable because they're literally like this big. Like this is a golf ball size. Like they're like this. So that helped a lot initially. I was like, wow. And then the last like 3 weeks, I feel like they have been coming back, and there's two entry points. He obviously did an entry point on this side to take out the liquid, and he did an entry point on this side, and both of those areas have discoloration. So anyways, after I got it done, which was like a month and a half ago, I don't know if I mentioned that already, I was like, oh, it's probably just like me bruising, you know, just like it was like a trauma point because he had to put the needle in there. It'll go away. And then it kind of stayed the same. And I don't know, maybe mentally I feel like it got like, I don't know. I don't know if it was like my brain playing tricks on me, but I feel like those spots on my boobs got darker. So I was like, no, absolutely not. Call the doctor. So called the doctor, made an appointment with the doctor. How the my skin's so sensitive. Anyways, called the doctor, got in with the doctor, and which is what you guys are going to be seeing today. So over the phone when I talked to him, he was like, I could have you send me pictures, but I just want to ultrasound everything, you know, just to cover all my bases. So I am going to be going in so they can do an ultrasound of both of my breasts again. They're going to be taking a look at everything and you know, just making sure everything looks good. I just like, if you're a hypochondriac, I feel like your brain just automatically wants to go to bad things. And like, I've been really being like, it's okay. Like, everything's fine. Like, or even, guys, it's as bad as like my eye twitched last night. And I'm like, what's going on now? What's happening with my body? And I hate that I'm like that because it causes like a lot of anxiety for me. And it's something that like is annoying. I hate to be like, I struggle with this, but I actually really do struggle with this. Like, it is very agitating and takes up mental space. So I like, when this whole situation happened, I was like, I feel like discoloration's still there. The lumps honestly started to feel a bit bigger. I was like, I'm not going to worry about this. I'm just going to call the doctor. Let's try pushing this to the back of my mind. And that's what I attempted to do. Was it successful? Kind of, sort of. I'm getting better at it. So I'm going to keep just practicing that because I feel like that's going to be good for my mental. So anyways, we're going to do that today and get that over with. He also, like, the thing that I hate the most is like when something comes up, no matter what it is, like if I break a nail, if it's like a health situation, if it's anything, like the second it gets into my mind, like, oh, I need to fix this or I need to go check this out, I want to be able to do it today. Like, I will drop whatever I have to do. I will take whoever I have to, whatever circumstance I need to make happen, I will do that to make sure that like I have a peace of mind, right? Like that I check it out or that I get my nail fixed. Crazy thing to compare nail fixing and that, but you guys just get what I'm saying. You know what I'm saying? So I've had to wait for this appointment for like 2 weeks, and as you guys know, I'm working. I'm just like super busy right now, so I've been waiting for some discoloration, mild discoloration. So I was like, let me just find her.
Oh, okay.
Let me just see what's going on.
Okay. So we're gonna follow everything.
Yeah.
Okay, we wanna make sure everything.
Yeah,
works
both
good.
sides, please.
Yes, yeah, of course. Okay. Same birthday?
Yes.
Okay. 3/19. We're gonna start off with the right side. So I'm gonna have one out of sleep here, and it's gonna go up above the head. I'm gonna be following these specific areas, okay? I just wanna make sure none of them are.
Yes. This is an area, kind of where you put the needle in.
Last time.
Yeah. But nowhere near like different.
But they've both been done, right? So.
Yeah. And Landon told me, he said that they can get bigger, and I was like, I don't know.
Yes, there's a possibility of it, the fluid coming back. Yeah.
How have you been good?
Good. Busy, but it's not a bad thing.
Yeah, no,
I'll
it's
take
good.
it.
Yeah.
What about you guys? Family's good?
Family's good. Busy, working, doing a lot of things. I'm going myself quickly. It's crazy.
Really?
Yeah.
She's so good.
She's walking now. She's talking. She's so much drama.
No.
No, really. I'm like, how I wish you had a cat at 16 months. Friendly little baby.
You realize.
My best friend is like, that's the What are you talking about? You work yourself. Do you have kids?
So, no, I want kids, but I
Enjoy this time without them.
okay, you find something first.
Yeah.
Because that's what we do. I don't think I could do this by myself. It's hard.
I tell everyone all the time, I'm like, single moms are like superheroes. Like, actually, this is nuts.
If I remember correctly, you guys have more than one.
So he has a
right?
6-year-old.
Okay.
Yeah, and then we have Saya. But that gap, like, at first I thought it was gonna be just, I don't know, tough. But honestly, as she's getting older, Saya, they both play really well together. I mean, it's mainly like his daughter playing with her, obviously, but it's still fun. It keeps them both entertained. And honestly, it helps them too.
Oh, I'm sure. Yeah.
If I'm like, I need a diaper, get the bottle, can grab her. She's really helpful.
That's so
Yeah.
versus it's like what they like. It's like it's an army.
It really is.
Like a village.
Village. Mm-hmm.
So it's good. And I feel like that's a good age gap. But I feel like
Yeah.
it's not too bad.
No, and I think as they get, like, I feel like me and my sister are the same age gap, same years apart. I
Oh,
think it's 7
Oh, that's
or 6, something like that. And I remember she was like annoying to me when she was like 9, 10. Like, it was just like, oh my god, I can't. But then as of now, it's like we're like best friends.
yeah.
I get along with her, it's like great, honestly.
I hear that exact same thing.
Do you have siblings?
I do. I have 3 older sisters and a younger brother.
Oh wow.
Yeah.
5.
Yeah. And then for us, it's like we're 12, 10, 2, and 2 apart. So,
Oh wow.
yeah.
So your mom waited a minute.
Exactly, yeah.
Same parents?
Same parents, yes.
Oh wow, yeah.
Yes. They all kind of, they wanted a boy. They really wanted a boy.
Yeah. But they got all, oh yeah, so the last one.
The last one, yep.
They were probably like, what the? So my dad, I'm like, I don't know how he did it. Just a lot of drama.
It really is.
Just a lot of emotions.
It's so funny because same thing with like my brother. He's like all the women.
That's good though. You know why? Because he'll end up being a really great husband.
And he is.
Yeah, if he's not married already, or
He's not, but his longtime
girlfriend?
girlfriend. Yeah. He's
Yeah.
great, yeah.
for sure.
So you're right on that end.
Yeah. And it's funny because I always tell him, like, no matter what age we are, we bitch about the same things as girls. Like, if me and him are in the room together, we're both going downstairs and he leaves before me, I'm like, you can't just like wait a minute. Like, I don't get it. We're both going down there. And his 6-year-old does the same thing. Like, Daddy, wait for me. Why? Well, just wait for me. It's like no matter what age, it's funny.
You know you're not wrong.
For sure. They're like, you didn't say I was beautiful. I'm like, wait a minute, he didn't say I was beautiful. I'm like, now we're both mad at him for the same thing.
It's like a tag team.
It's funny.
If it's not one, it's the other.
It's the other, yeah.
Pretty cute.
Yeah. This age is like the fun age because I feel like they're turning into actual humans. They're not like potatoes, they're talking, expressing themselves.
She's having fun.
Yeah, she is. She's in everything right now. She just wants to be everywhere, touching everything.
With everybody.
She's definitely like selective though. Like she started getting really like, let's say a couple months ago, her separation anxiety got bad, like from me and Landon. And she's always had stranger danger, especially with men. I asked Chat, I'm like, what's up with her not liking guys? It's like Chat said it's common. So I was like, huh. But with girls, she loves women. Just guys, she's like,
She's just like, no, I
no,
don't want
thank you.
I get it.
Yeah, I'm like training her young.
Yeah.
close with your siblings?
I am. I didn't always used to be.
Yeah.
Yeah. I
As
feel
you guys got older, probably?
Yeah.
Right? Yeah.
As we got older, yes. But before, not really. Like I said, it's 10 to 12. That's really big age gap between us. So back then, no, not as much. Now it's a lot.
Yeah.
I was closer to my brother because we were more closer in age since we're just 2 years apart.
So it's probably your two oldest and then you two now?
Exactly. The two oldest were the closest, and then my brother and my sister were like closer to me.
Oh, yeah. Yeah.
They were. Those are the ones that really got close.
Are they in LA too?
Yes, yes, they're in LA, yeah.
Were you born here?
I was born here. Yeah. What about you guys? You guys born here? No, right?
He was born in Palmdale, so close. But I was born in Texas.
What?
Yeah, crazy. We moved when I was like 16, I think. And then my parents ended up going back, but I was like, I could never, ever.
What part of Texas?
El Paso.
Oh, okay, okay.
It's really like Mexico, honestly.
Really?
Yeah, like, it's just a lot of, it's not a big city. It's not like Houston, Dallas, and Austin are like super fun. They're big cities, but El Paso is just like smaller and just not as fun, honestly. There's not a lot to do. There's a lot of desert.
I've only ever been to Austin.
Austin's fun. Did you like Austin?
I did. I was there for work.
Oh, okay.
Yeah. So I used to travel for work. So I went for one assignment over there, and yeah, I liked it. It was very. It was actually nice. It was very nice. Yeah. The food there is great. I'll tell you that. You guys in Texas.
I was
the food there is
just
great.
talking about this today. The barbecue. Oh my gosh, I miss it. So good.
It's not the same here.
No.
It's literally the same. No, they try.
They try, and it doesn't even get close, honestly.
No.
What were you doing before this?
What do you mean?
For work.
Work? Oh, same thing.
Oh, so you were just traveling doing it.
Yeah.
Oh, that's fun. That kind of switched things up, no?
It does.
Yeah.
It does because it's like I see a lot more stuff. So I used to do more than just breast.
Oh,
So
okay.
yeah, it was like a good amount of different kind of stuff, like not just breast, and yeah, it kind of gives me a good like of everything.
Yeah.
Yeah.
That's fun.
So definitely, yeah. Kind of like nice. It was nice.
It switches things up.
Exactly. But I'm not a big cold person. So
No.
whenever there was like a time where it was funny, I was telling a different patient
Mhm.
that like there was a time where I was like in like it was in New York when it was like snowing, like peak snow, and I was like, I can't do this either.
No. Not that.
Right. And then go ahead. Let her grab you another towel.
Oh, I could just use
Okay.
this one. Yeah, no worries.
Perfect. Let me go ahead and give this to him.
And he'll be in, right?
Correct. He'll come right on in after as soon as he's done reviewing everything,
Okay.
making sure how everything
Looks.
right?
Okay.
Yeah, so you want to take a look not just of those two that we did the aspirations, but all the other ones that we saw last
Saw.
time.
Yeah. Okay, perfect. Thank you. Thank
No,
you.
of course.
And just so I know, I'll ask him, but does he measure? I'm assuming he measures everything, right? Every time?
Correct, yeah.
Yeah.
We remeasure everything, because that
Everything.
helps us check whether to see if something is growing or not.
Staying the same.
Exactly.
Did you ever do ultrasounds with babies? Like for babies?
did.
You know, they sometimes can feel bigger if your breasts have gotten smaller. Then those areas may feel bigger because there's less tissue around it. Have you
Yeah.
lost any weight?
No, but I have been taking peptides. Is there
Okay.
any sort of like hormonal shift that can maybe make them feel bigger or anything like that?
I don't think so.
That's
I don't
literally
think
the only
so.
difference. I
Yeah.
stayed the same weight.
So both of those areas that I drained, that I took the fluid off of, the fluid is gone. There's no more
Okay.
fluid there. There now it's just like the dead fat that's just solid,
There.
just sitting there.
Okay.
I don't know how much better those are gonna get
Yeah.
because whatever was liquefied or liquid, I was
You
able to
took it
pull
out.
it off. But
Yeah.
whatever's residual there, it's more solid, and so
Yeah.
I can't take that out.
Could I show you my breast
Sure,
really quick? Because
sure.
my main concern was there's some discoloration. I'll just look at you like here. Do you see how there's this?
This up here.
Yep, I never had that before. There's no pain. Like, there's no painful anything. But this was the area where I did notice you came in from.
Yeah.
But it's been a month and a half, 2 months.
That's fine. It's just that this area, the lump is closer to the skin now.
Yeah. So really the only
Man, this really got hardened like that.
That's what I'm saying. I feel like it got
Who was
harder.
the surgeon that did it?
Dr. Yamin in Beverly Hills. He did.
Yamini? Dr. Yamini?
Yeah.
Okay.
I wish I would have never seen him if I'm being really honest with you.
Really?
Horrible. But story for a different time.
Oh my gosh.
But I would basically have to get surgery to take them out, right? Yeah.